Welcome to this video. My name is Pedro Rodrigues Ribeiro. I'm a psychologist from Portugal. And first of all, I would like to apologize because if you saw my last video on integrative psychotherapy models, I mentioned that my new video would be about multi-model therapy from Arnold Lazarus. Unfortunately, I haven't the time to do some research or to go into deep dive in multi-model therapy. So I would like to introduce to you a new model, and then with time I will be talking about multi-model therapy. So the psychotherapeutic model that I would like to talk about today is DBT, or Dialetical Behaviour Therapy. So DBT is an integrative psychotherapy model which combines attachment theory, emotion theory, behavioral therapy, cognitive therapy, but also concepts from certain lines of Buddhism, and like acceptance and compassion. DBT was created by Marshall Linehan, initially a cognitive behavioral therapist who is also a Zen master. So she studied Buddhism and Buddhist principles for a lot of years. DBT originally was created to deal with borderline personality disorder, as chemotherapy, for example. Although DBT nowadays is considered to be the main standard in borderline personality intervention, more than chemotherapy. Some DBT approaches might be utilized in other disorders, but mostly DBT is focused on borderline personality disorders and very tough cases. So Marshall Linehan admitted that she created DBT as a response for her own health, her own issues. So DBT was created to deal with personal issues of borderline disorder. So dialectical behavior therapy is considered to be one of the third waves of CBT, of cognitive behavioral therapy, as for example mindfulness-based cognitive therapy, and acceptance and commitment therapy, and compassion-focused therapy, etc. So DBT is a variant of CBT, but it also integrates other concepts from other approaches. The part of the acceptance and commitment and compassion, and also a radical acceptance and radical genuineness is really a trademark of DBT. DBT is considered to be an approach not only for adults but also for teenagers. So it's a very well researched and evidence-based model. DBT is also a model that works in phases. It depends on the state of the patient. For example, if someone is at suicide suicidal risk or with um, self-damage behaviors, a DBT therapist will initially make a contract with with the patient to stop those behaviors. So in the early stages, really behavioral therapy and behavioral modification is one of the main focus of DBT. So stopping the risky behaviors, so the therapist can work with the emotional and cognitive sides of the person, always with a radical acceptance of who is the client, who is the patient, but also the situation and all the vulnerabilities and barriers of someone's lives. DBT is also utilized in individual but also in group therapy. Some studies and some authors really strive to investigate, to research DBT for group therapy. Also, it's well validated for online and phone interventions. That's curious enough. You can have a DBT intervention on the phone. So it is a research thing, and you can find manuals on how to do DBT online and on the phone. So it's very useful. As I mentioned, DBT is considered to be the gold standard for borderline personality disorders in terms of intervention. So its efficacy, it's well established, but also on certain disorders, like for example eating disorders. Also, I think that if you can integrate the phases of DBT, certain concepts and certain ways of working in DBT with your practice, you can make your intervention more efficient, because DBT is a very useful model, especially for tough situations, for tough cases. This is a general concept of DBT, so I will not go in too much further. I will suggest to you, if you would like to know more about DBT, I would suggest the DBT Skills Manual from Marshall Linehan. I will suggest to you the new edition of the Dialetical Behaviour Therapy book, that it's written by Alexander Chapman, who is a DBT therapist. That book is a new issue from the APA series on psychotherapy models. And also, I think the classical one that Marshall Linehan wrote to originally develop DBT, that is cognitive behavior. Cognitive behavior for borderline personality disorders. I think it's something like that. Please check out. If you Google Marshall Linehan's name, you will find that specific book. It's a classic on borderline personality disorders, and it's the first book that Marshall Linehan utilized or conceptualized the foundation of DBT. Also, it's important to say that DBT, like most third wave CBT approaches, the third generation, so to speak, also integrated aspects from mindfulness. So mindfulness, it's utilized as a specific approach in certain phases of DBT. And it makes sense since Marshall Linehan is a Zen master. So she is well well equipped, so to speak, to to give meditative exercises to the patients. Lastly, I will suggest to you a recent autobiographical book that Marshall Linehan wrote about herself, her life, and the development of DBT. It's a very interesting read since DBT in its foundation is well entitled, mixed with Marshall Linehan, because DBT was created for Marshall Linehan to deal with her issues. I would like to thank you for your time, and if you like this video and also this kind of content, please subscribe and share with your friends. I will try to make an effort to talk to you about multimodal therapy from Arnold Lazarus in the next video. Until then, please stay safe, have a nice weekend, and have a nice week. I'll see you soon.